Self-awareness, perhaps, which is one of the first tenets that you talk about in the book, maybe one of the most elusive. I would gather, and I would love your input here. But it's sort of essential to get us in the race, right? To get at the starting line, to have self-awareness. And in the book, I forget her name now, but you were talking about this mother who didn't really drink wine, but then COVID happened, and then she was homeschooling her children, and then she was working from home, and then everybody was, and all of a sudden she went from the occasional drink to downing a bottle of wine, every night during dinner preparation. So how can we first improve? How do we sort of read the label of the jar that we're in, I guess, is my first question. And then moving into how can we begin to become aware in our everyday lives? As you mentioned, as a practitioner, a clinician in New York City, it's a very busy, loud, noisy, sensorial overload type of environment. So how can we, when we're constantly looking outside of ourselves, friend or foe, how can we sort of get inside of our own bodies to become aware of habits and patterns and schemas and filters and the things that might be sort of operating just beyond our conscious awareness?
I love that, Dr. Stephanie. That really, what you just listed off there speaks to it. I like this idea of how do we understand the jar that we're in? And I think the first is to really have an appreciation that your unique nervous system and your development, right, the milieu or the environment in which you were in, how you were loved and cared for or not, ways that you fit in or not, traumas that you've had, big, little, whatever size T it is, any good therapy or a therapy experience where people grow in their self-awareness is thinking through usually some aspects of their development and some aspects of your relational pattern. If you're constantly having problems at work in the same way, people who transcend that gain self-awareness of what they're contributing to the problem. So in Healing the Modern Brain, I take a few very specific techniques from my psychotherapy room that I found to be very useful. And the first one I think everyone listening can see in their everyday life, especially with this audience, because I hear this a lot out of my female patients, which is they'll tell me a lot of what they know about something. It just, kind of the best list. In some ways, as you just did, right? You just gave this really beautiful list of what does it take to get more self-aware. But then often I'll hear, well, I don't know, doctor. What do you think? Something like that. And for me over time, I've sort of heard this as almost a cue that you've really listed all the things that you know. You might be unclear what to do about it, or you might not have a clarity in terms of your next step, but you certainly have profound knowledge. And so I think first is kind of sitting and grappling with some of the truth of what you know. You mentioned Charlotte was the name, and I changed the details about my patients to protect their anonymity, but this book is really from wonderful moments with patients over the years, really my greatest privilege in this life to get to take care of people and get to be their psychiatrist and their therapist. And you just see it, and this happened with Charlotte, of her just gaining a real clear awareness, right? And it sounds kind of obvious, right? But just she was coping with drinking, and it started out as kind of normal COVID coping, normal pandemic coping. And then I think for so many people in their 30s and 40s, it really starts to take quite a toll on sleep, on cognition, on gut health. We normalize a lot of excessive drinking. And so some of what I get into, and when you asked earlier about barriers to mental fitness, some of that are some of the habits and some of the patterns we've gotten into as a modern culture. We like to overeat and overindulge. There's usually a lot of alcohol involved. There are a lot of gummies, powders, tinctures, salves, all kinds of stuff, ranging from legal to illegal to supplemental to psychedelic floating around these days that people are kind of fiddling with, let's say, and experimenting with. And so, again, one of the things we want to do with self-awareness is have people maybe take a step back from all of the experimenting and think through what you're actually, in a clear way, after. Right? What are the major challenges? As I think about clinically with patients, you triage it a little bit. If there's something on fire, we're going to put that out first. And then we're going to think about dealing with that. And then we're going to think about, of course, where did this fire come from so it doesn't get started again. But there's that kind of sequencing. And so self-awareness is asking you to really do that thing we all say as clinicians, right? What do? We try and meet you where you are. Well, it's really asking you to take this from the clinical room into your life. Meet yourself where you are, right? If you're drinking every day, it's like, oh, it's awesome self-awareness. I really appreciate that. And before you get into self, kind of loathing or goals, or just first to just see that. How's that happening? How did that start happening? So those are Now, some of why, again, self-awareness is that first really important step, right? That we begin to think about ourselves as empowered, in control. And the last one that's very hard, responsible. That the only person who really, at the end of the day, truly is going to care about this in the most meaningful way is you. And that might sound a little selfish. One of my patients asked me, it's like, isn't that selfish? Maybe this book is asking people to be selfish in a bit of a different way. If selfish is around creating boundaries by which you engage in more self-care, more self-awareness, I think that leads to, whenever you're engaging with the rest of us, a much more powerful, more potent version of yourself. You're in what we call a better stance. So if that's selfish, okay. A little bit of that's probably good for some people.
That's fantastic. And I've spoken about this on the show before, where I've contrasted the idea of being selfish versus selfless. When you are selfless, you are just giving without regard for yourself. And I think selfish, in sort of the modern context in which it's used, is often a derogatory term. So we tend to shy away. Women, we don't want to be selfish. We don't want to be seen as the snob or the person who's only this sort of, I don't want to use the word narcissist, but sort of self-consumed person who doesn't have any regard for anybody around her. But I do think that, and I would say this is true, at least, and this might be a bias because I tend to speak to more perimenopausal women, but we are very much nurturers and caregivers by nature, and we often don't make our own to-do lists, right? Like, we have all these other people and all these other things that we're trying to achieve and help and support, and we often forget about ourselves. So I really love what you just said around, is it selfish? Okay, can we be a little bit selfish in the context of setting boundaries for ourselves and say, this is what I'm willing to do and this is what I'm not willing to do. And I'm not going to be a martyr and be selflessly giving, so that, it's like the airplane is always, put your own air mask, or put your mask on first and then help the people around you. I think that's usually, I think it's a longer lesson. I'll say it that way. I think it takes, at least I've seen, and in my own life and my own personal N of one, I've seen that as well. It's harder for me to put myself first versus putting, my children or, the other people that I sort of hold in high regard and I love, more than anything.
Well, and it's also such a comfortable setting, I think, for women, of being of service in that way, of being a caregiver. So many accolades for that. It's sort of like, for me as a man, having a job and earning. It's that's what you do, it's like some home projects maybe. And so I think that notion of the compass on, selflessness, as you're talking about, the compass on what is selfish and what isn't, feel very skewed to me. Because so much of identity for perimenopausal women is about being a caregiver, taking care of others. And so this switch, or this, what I think is very exciting culturally, this kind of turn that's happening into what has been described to me by my patients and by, I think, a lot of people in the space, kind of this phase of life of no fucks left to give. And not that people don't care about others, but that there's this notion of having been of incredible service and now needing to be involved in dynamics that are a little bit more interesting and complex. And so it's coming out, I think, in this very sexual way right now, which is, I think, fun. I'm curious what you think about that, because it feels like suddenly perimenopausal women are the hottest, kind of spiciest focus of attention.
We're muscle mommies now, yeah.
I know, if I'm allowed to say that. It's kind of, I blush a little bit, but I think it's really wonderful. It's always maybe been kind of where my attention or preference has been, maybe just, but also it feels, there's something really invigorating, because it speaks to a power of kind of sensuality and sexuality that revolves around self-knowledge, self-awareness, and again, being in more kind of interesting, more complex dynamics than just being of service.
Yeah, and kind of knowing who you are and who you aren't. I think that I can speak for myself and say that I spent a lot of my 20s and 30s trying to be everything to everyone. And sometimes I really succeeded, and sometimes I fell flat on my face. And I feel now in my 40s, I really do understand what I'm really great at and what I'm not great at. So I can take on the things that I'm great at with vigor and excitement and passion, and the things that I'm not, I can set a boundary and say, hey, I'm not, this is not my strength. So I think that there's also, maybe to your point around that sort of sensual, it's sort of understanding who you are, and there's confidence in that. And I think that we've all, culturally, and I can, people are confident it's not a look. It's not like a certain bag or pair of jeans that makes you confident. It's how you actually feel in your own skin. And when you know who you are, and you can sort of show up fully in that space, I think I think that's maybe what you're touching on, is that sort of, really, it's exciting. I'll say that it feels exciting for a woman to kind of come into her own skin and say, yeah, like, this is who I am, and this is how I want to show up, and this is what I want to be doing.
Oh, I love that. And I think it's also a much nicer way of thinking about development. So often, I think especially for women, it's like, the 20s and 30s are supposed to be where it's at. And I think so often for women, there's such a striving around identity, around, as you're saying, that clarity you have of, hey, there's things I'm just not very good at, not that interested in. Mm-hmm. And there are things I'm great at. I want to focus more on those. Not that you're going to not be a well-rounded person, but again, more clarity and identity that I think helps us feel confident and engage more effectively. And it's a really nice way to think about this era, because I think so often in generations before us, right, like you and I are both done. You're like, I'm in my 50s, you're in your 40s. It's like the best of our years are behind us. Like I'm no longer strong and potent. And I don't think that's true at all if you play your cards right. I mean, that's not been my experience of it at all. And it doesn't sound like yours either.
There was something else that you said that I wanted to just underline and double click, this idea of responsibility. I have said maybe, and people maybe don't like it, but it's like no one's coming to save you. This idea of the prince riding up on their
None
horse.
of us like that. I don't like that. No. I want the prince to come and save me. Like, who the fuck doesn't want the prince to come save them? Like, it's a great idea. I mean, it's just, you're right. It's not going to happen.
It's not going to happen. So, the person who's going to save you is you. And so I talk a lot about weightlifting and resistance training for women and technique and range of motion. My background as a chiropractor, really understand like joint mechanics and body mechanics, et cetera. And so often I'll have people, like it's this or it's that. And it's like, all right, but you can't get upset for the results that you're not having with the effort you're not putting in. And so this comes back a little bit to responsibility, because no one's coming to save you. No one's going to lift the weights for you. No one's going to build the plate for you. No one's going to set boundaries with your mother for you. You have to do all those things. And so it can be hard to hear, but I just wanted to just maybe marinate in that for a moment and have you expand on this idea of responsibility, because I think it is important for women to hear, probably on this podcast ad nauseum a little bit, but I would love to hear it from you as well.
I want you to hear responsible, but not alone. As you say, like, it is up to you to set boundaries with mom or to go to the class, but you're not alone in that. You can get help from someone like me to talk through it and to think about strategies. You can do something like the favorite perimenopausal woman in my life who has started going to Orange Theory classes and is like stronger. This my wife is like stronger than she's ever been. Like, I think she's a little stronger than I am now. It's like very hot, very fun, but not the kind of thing that happened without like a group context, some challenges. And so, but yes, I like the idea of us taking responsibility. I think it's very hard when you're struggling, right? Anyone listening right now who's really struggling with symptoms of depression, anxiety, perimenopause, insomnia, itchy skin, brain fog, this idea that like, hey, it's all on you. Like, I can appreciate that can come across and sound overwhelming. Part of where I wanted to give the tenets of the book was to really help people direct their attention towards what works in the kind of biology and neurobiology of the brain and the kind of new science of the brain, and how even things like taking responsibility, right? Like, what's a easy, quick, free thing if you can't afford therapy? I'd want you to journal. There's some journaling prompts in the book. Why? Because studies show that journaling increases the functionality of our prefrontal cortex. This is the part of our brain that basically works, does executive functioning, working memory, like we call it GSD, get shit done. So that's frontal lobes. You have more activity in that part of your brain when you journal regularly. Like, wow, that's very cool. And over time, for people who are in more self-reflective activities, whether it's journaling or therapy, there's some studies that show like a 14 to 15% increase in gray matter. Those are neurons. So it's just like more brain cells. And so again, what I hope people see in the book is stories like the story of Charlotte and several other of people I've worked with over the years, and how their lives change, sometimes in unexpected ways. But there's deep science behind it in terms of how these activities affect our brain, sort of where we want to take responsibility in a new way, because we have new knowledge, because we have new challenges from the modern world.